theoretical portion was not carried out. So let's begin. Right? So this definition, all of you should know this definition. Right? This definition should be in the tip of the tongue. यो चाहिँ okay, this is very important definition. This is in fact a life savior definition. है भाइबा point of view बाट के आन्सर गर्न सकेन भने at least you should be able to answer what is cyst. है so cyst को complete definition you should know this. This is the definition of cyst given by Kramer in 1974. A cyst is a pathological cavity having fluid, semi-fluid or gaseous content and which is not created by the accumulation of pus. It is frequently but not always lined by epithelium. So by this definition what we should know is cyst is something called as a pathological cavity. Okay, it is not a physiological or anatomical thing, it is a pathological thing, cavity that contains either fluid, semi-fluid or even it may contain only gas, or on exploration the cystic chamber may be just empty, right? And which is not created by accumulation of the pus. If something is formed, if some chamber is formed by accumulation of the pus, we don't call it a cyst. And most of the time the cysts are lined by epithelium. And sometimes the cyst may not be lined by epithelium and only the epithelial lined cysts are known as true cyst. Keep this point in mind, only the epithelial lined cysts are known as true cyst. Cyst without epithelial lining is known as pseudocyst. Okay, this definition is very important. A pathological cavity having fluid, semi-fluid or gaseous content and which is not created by accumulation of pus. It is frequently but not always lined by epithelium. Now this classification of the cyst, it is very important. It's big but it should be in your mind. Cyst can be broadly classified as cyst of jaw, cyst associated with maxillary antrum and cyst of the soft tissues of mouth, face and neck. Now let's see cyst of jaw. Jaw cyst can be either epithelial lined or non-epithelial lined, भनेको true cyst or pseudocyst. And epithelial lined cyst may be either developmental in origin or inflammatory in origin. Example के थियो त developmental origin को dentigerous र ओकेसी, inflammatory को radicular cyst. Now let's see epithelial line को developmental cyst हरु के छ त. अब त्यो cyst epithelial cyst of the jaw आयो फर्स्ट मा, त्यसपछि epithelial line cyst आयो. epithelial line को पनि developmental र inflammatory थियो. अब developmental मा you have again odontogenic and non-odontogenic. So developmental odontogenic cysts are gingival cyst of infant, odontogenic keratocyst, dentigerous or follicular cyst, eruption cyst, gingival cyst of adult, botryoid odontogenic cyst, glandular odontogenic cyst, and calcifying odontogenic cyst. So these are the odontogenic cysts. They are developmental in origin, they are lined by epithelium and they are present in the jaw. We should discuss all of them in detail. Right? अर्को थियो non-odontogenic, developmental cyst but non-odontogenic. के हो त? These cysts, they are formed along the union of two different bones. Right? जस्तै nasopalatine duct cyst, also known as incisive canal cyst or nasolabial cyst. है दुईटा बोनको अथवा दुईटा टिस्युको जंक्शनमा नेजो प्यालेटाइन, नाजल र प्यालेटाइन बोन, नेजोलेबियल नोज र लेबियल फोल्ड, मिड प्यालेटल राफे सिस्ट भनेको एट द जंक्शन अफ द मिड प्यालेटल राफे, मिडियन प्यालेटाइन, मिडियन म्याक्सिलरी एन्ड मिडियन म्यान्डिबुलर सिस्ट र ग्लोबुलो म्याक्सिलरी सिस्ट. These are the non-odontogenic but developmental epithelium-lined cyst. Inflammatory ma we have radicular cyst, residual cyst, paradental cyst र inflammatory collateral cyst. Non-epithelial cyst अथवा pseudocyst को example तिमीहरुलाई एकदम commonly भाइबामा सोध्छ. Define cyst and then name few odontogenic cysts. Those are developmental in origin. Bhन्छ Viva question. Name few odontogenic cysts, those which are inflammatory in origin, or name few pseudocysts. भन्यो भने solitary bone cyst and aneurysmal bone cyst. The spelling mistake भयो. It is A and E. है ANEURYSMAL. E पनि छ है यहाँनिर. So this is solitary bone cyst and aneurysmal bone cyst. These are the common example of the pseudocyst. And we have अर्को चाहिँ salivary gland को cyst is also there. जसमा mucocele or mucus containing cyst, that is the common cyst of salivary gland. त्यसमा mucus cyst is also of two type. है एउटा चाहिँ हुन्छ retention type, एउटा हुन्छ extravasation type. So that retention type of mucocele is a true cyst because it is lined by epithelium. Non अथवा extravasation type है duct rupture भएर saliva बाहिर spill out भएर form हुने cyst is extravasation type of mucocele, that is non epithelial or pseudocyst. है so three pseudocyst को example: solitary bone cyst, aneurysmal bone cyst and mucocele, which is extravasation type. Cyst associated with maxillary antrum, we have benign mucosal cyst of maxillary antrum and post-operative maxillary cyst or surgical ciliated cyst of maxilla. The cyst of soft tissues of mouth, face and neck, dermoid and epidermoid cyst, branchial cleft cyst, thyroglossal duct cyst, अरु more cysts है cystic hygroma, thymic cyst, cyst of salivary gland मा थियो mucocele र parasitic cyst. Can anyone name any one parasitic cyst?
Hydrated.
Raw काँचो beef अथवा raw yes hydrated cyst. एउटा hydrated cyst भयो. अर्को एउटा छ brain मा हुने common
Cystic sarcosis.
yes neurocystic sarcosis. So this is the huge classification है यो classification चाहिँ थाहा हुनु पर्यो. Cyst of jaw, cyst of maxillary antrum and cyst of soft tissues of mouth, face and neck. According to tissue of origin, if you try to classify the cyst, cell rest of Malassez बाट के बन्छ त periapical cyst र residual cyst. Reduced enamel epithelium बाट dentigerous cyst and eruption cyst. Dental lamina or cell rest of Sere बाट OKC, gingival cyst of newborn, gingival cyst of adult, lateral periodontal cyst र glandular odontogenic cyst. र few cysts whose origin has been unclassified, they are paradental cyst and calcifying odontogenic cyst. है यो फर्स्ट को तीनटा चाहिँ you should know. Cell rest of Malassez बाट कुन cyst भन्छ, reduced enamel epithelium बाट कुन cyst भन्छ, अनि dental lamina को remnant, that is cell rest of Sere बाट कुन cyst भन्छ. Now let's see dentigerous cyst. अब यो definition पनि you all should know. A dentigerous cyst is one which encloses the crown of an unerupted tooth by the expansion of its follicle and is attached to the neck. भनेपछि के हुनु भयो त crown of the unerupted tooth involved, it should be involved to say a cyst is dentigerous, and this thing यो जुन cyst को lining जुन छ, it has to be attached to the neck of the tooth. Your cervical region, if there is no attachment, you cannot call it a dentigerous cyst. Who is Monica Paudel? It's hamरै क्लासको हो?
Yes, ma'am.
Okay. Right? So this definition of dentigerous cyst, you have to know it is a cyst which encloses the crown of an unerupted tooth by the expansion of its follicle and it attached to the neck. Your cervical region, if there is no attachment, you cannot call it a dentigerous cyst. Pathogenesis, there is either intrafollicular theory or extrafollicular theory. Intrafollicular theory says there is the dentigerous cyst. It develops by the accumulation of fluid between reduced enamel epithelium and the enamel or within the enamel organ itself. This tooth, once it is formed, right, your thin layer of reduced enamel epithelium, jasma there was only outer and inner enamel epithelium. Once the crown is formed, until it erupts into the oral cavity, it is being preserved by a thin layer of enamel that is known as reduced enamel epithelium. So यो cyst यति thick हुनुभन्दा अगाडि it was very thin according to intrafollicular theory. Right? It was very thin. Tooth erupt हुन खोज्दाखेरि it exerts the pressure. है माथितिर superficially it exerts the pressure. त्यो pressure exert गर्दाखेरि there is a continuous pressure development by the tooth in an attempt to erupt, but it cannot erupt properly, maybe due to crowding or maybe due to the malalignment of the tooth within the bone. Medially impacted अथवा distally impacted, whatever position ले गर्दाखेरि आउन सकेन भने that pressure will lead to expansion of this follicle. है त्यो follicle reduced enamel epithelium लाई यसले expand गराउँछ. Expand गर्दा गर्दा it becomes this large and it is now termed as dentigerous cyst. So this is what त्यो तिम्रो tooth enamel र reduced enamel epithelium को बिचमा त्यहाँनिर pressure create भएर fluid accumulation भयो भने it results into formation of the dentigerous cyst. Right? This is the simple pathology. अर्को चाहिँ के भन्छ pathogenesis, crown of a permanent tooth may erupt into a radicular cyst of its deciduous predecessor, though this is a very less accepted theory. Right? But they still pathogenesis of dentigerous cyst भन्दाखेरि you may write intrafollicular theory, extrafollicular theory. र अर्को भनेको crown of permanent tooth may erupt into radicular cyst of its deciduous predecessors. भनेको तिम्रो deciduous को first molar र second molar सम्म you have अथवा permanent premolar, it erupts below the primary second molar. हैन? So यदि primary molars मा radicular cyst छ भने त्यो ठाउँमा erupt भइराको permanent tooth को follicle may enter and त्यो space मा it may result into formation of cyst भनेको एउटा theory छ. But erupting tooth जुन हुन्छ, erupting premolar हुन्छ, that may indent rather than penetrate the cyst. Right? So this is very less accepted theory. र अर्को भनेको radicular cyst, inflammatory cyst in the primary dentition is very uncommon. Dentigerous cyst को fluid, it contains glycosaminoglycans, that is hyaluronic acid र heparin and chondroitin sulfate. जसले गर्दा it increases the osmolality of the cystic fluid and it is thought to play a role in the expansion of the cyst. Clinical features, frequency 20% of the jaw cysts are dentigerous cyst. Age peak occurs between 2nd to 4th decade. It is the most common jaw cyst in the first decade. Male to female ratio भनेको 3:2, males मा more common and more common in white. Please try to come early. I won't allow. It's so disturbing. I won't. एकचोटि आएर यदि disconnect भएको भने I will allow. नत्र भने I won't allow. Next class, but it's so disturbing. See, because of you, all of your friends are being disturbed. Site, permanent teeth, most common site भनेको it is जसरी हामीले भन्यौ unerupted tooth. It has to be associated with the crown of an unerupted tooth. भनेपछि मोस्ट कमनली अनइरप्ट हुने मोस्ट कमनली इम्प्याक्ट हुने भनेको म्यान्डिबुलर एन्ड म्याक्सिलरी थर्ड मोलर म्यान्डिबुलर एन्ड म्याक्सिलरी थर्ड मोलर म्याक्सिलरी क्यानाइन र अरू पनि हो सो मोस्ट कमन साइट इज म्यान्डिबलको एङ्गलमा अनि म्याक्सिलरीको थर्ड मोलर र कनाइन रिजनमा अनि सुपरन्युमेररी टिथ है जुन टिथ एक्स्ट्रा टुथ इफ इट इज सिन इन द ओरल क्याभिटी इट इज एक्सट्र्याक्टेड हैन तर नदेखेको केसमा इम्प्याक्टेड बोन भित्रै इम्बेडेड भएर बसेको सुपरन्युमेररीहरू द्याट मे बी अल्सो एसोसिएटेड विथ dentigerous cyst. So if there is any supernumerary impacted teeth, it has to be extracted. Now, bilateral and multiple dentigerous cysts are associated with Martex-Lamy syndrome and cleidocranial dysplasia. This is the common MCQ question. Where do you find or which syndrome is associated with bilateral and multiple dentigerous cysts? Usually dentigerous cyst is unilateral, right? Tara, it is seen bilateral and multiple in number in association with Martex-Lamy syndrome. Euta arko bhaneko cleidocranial dysplasia. Clinical presentation may be asymptomatic, slowly enlarging swelling, painful if infected, expansion of the bone result into facial asymmetry, displacement and resorption of the teeth, hollowing out of the ramus, र maxilla छ भने sinusitis. Mandible मा छ भने tooth will be pushed towards the lower border of the mandible. See, radiographic feature, you have a unilocular radiolucent area which is associated with the crown of an unerupted tooth. This is the crown of unerupted tooth. The cyst co-lining, this is the cyst, right? To say a cyst in a radiograph, you should find a well-defined radiolucency surrounded by a well-corticated border. Right? Ill-defined radiolucency, it would be more of the, most of the time it would be abscess. Right? So cyst unalai, a radiolucency, well-defined radiolucency with a corticated border. Right? If that border is attached to the cervical portion of the tooth, it is a dentigerous cyst. Sometimes we may see the impression of multilocularity, hey, but see, यसमा पनि there is a well-defined border, sclerotic border surrounding a well-defined radiolucency. See, associated with the impacted teeth. This could not erupt because of its position. This also could not erupt because of its position. See how it is located. This did not get the enough space here. If it would try to erupt, this would occlude the space. Right? Same thing. See, how will it erupt into the oral cavity? Such a big lesion. Histologically, small dentigerous cyst, you have an enlarged dental follicle. Right? How will you differentiate? Dental follicle pani erupt hone belama it will be enlarged. So, if the follicular space is more than 5 mm, right, this one, if this space is more than 5 mm, you call it dentigerous cyst. If this space is more than 5 mm, 3 to 4 mm, it may be simply an enlarged follicle, but whatever it is, if it is associated with the third molar, better extract the tooth. 3 variant radiologically, central, lateral and circumferential. Central भन्नु बित्तिकै symmetrical involvement of the crown. Hey, crown center ma huncha, left, right, सबैतिर equal amount of space huncha. Lateral bhaneko only one side of the only one aspect of the follicle is dilated, either left or right. Circumferential bhaneko C is keep one thing in mind. जुनसुकै variant ma pani the lining is attached to the CEJ or neck. Right? र circumferential ma चाहिँ entire crown, root, everything is covered by the expanded follicle. See, central, CEJ बाट सुरु भयो. It is encircling the crown. Lateral, there is no lesion here, but this side there is the involvement. Circumferential भनेको whole thing, crown and root, everything is involved. It has a greater tendency to produce root resorption. See, किनभने root reserve गर्ने factors are derived from the dental follicle. Release of bone resorbing factors from the cyst wall. है cyst को wall बाट it has a bone resorbing factors like prostaglandin E2 and E3, interleukin 1 and TNF, tumor necrosis factor. यसले गर्दाखेरि these three factors they result into resorption of the root of the adjacent tooth. अब histological finding, epithelial lining is derived from reduced enamel epithelium, which is 2 to 4 layers of the flat cuboidal cells, characteristically non-keratinized. Flat cuboidal अथवा squamous cells के 2 to 4 layers हुन्छ. It is characteristically non-keratinized. There is no retireses unless inflamed. Secondary infection भयो inflammation भयो भने there may be presence of retireses. It may have discontinuities. Sometimes superficial layers may be low columnar that retain the morphology of amyloblast. किन amyloblast भन्यो त भन्दा किनभने यसको सोर्स त reduced enamel epithelium हो. Reduced enamel epithelium is the mixture of outer enamel epithelium and inner enamel epithelium, and inner enamel epithelium is responsible for formation of the amyloblast. है so sometimes superficial layers may be low columnar and that retains the morphology of amyloblast. Thin fibrous connective tissue wall derived from the dental follicle. Inactive odontogenic islands may be seen. Abundant myxomatous stroma may be seen. र minimal inflammation. Myxomatous stroma भनेको ground substance that is rich in acid mucopolysaccharides. See, this is how a dentigerous cyst looks like. है this could be seen हैन हाम्रो स्लाइडमा तिमीहरुले यही देखाएको थियो. Only 2 to 3 layers of reduced enamel epithelium को layer मात्रै थियो. This is connective tissue with less inflammatory cell infiltration. Lumen doesn't contain any keratin. Right? Lumen doesn't contain any keratin. Variations say there may be mucous cells in the epithelial lining. If maxilla ma ho भने चाहिँ यो common हुने भयो. Ciliated cells in the epithelial lining may be present. Sebaceous gland in the cyst wall may be present, or lymphoid follicles may be present. Now this rostron bodies, these are very important features. Okay, again for MCQ and Viva point of view, where do you see rostron bodies? Okay, in the dentigerous cyst. These are the linear, curved, hairpin shaped, probably hematogenous in origin. Okay, linear पनि हुन सक्छ अथवा कर्व पनि हुन सक्छ. र these are the eosinophilic material, pinkish हुन्छ र blood बाट origin भएको हुन सक्छ. So origin of rostron bodies could be hematogenous. Cystic lumen contains thin watery yellow colored fluid अथवा straw colored fluid. है sometimes blood हुन्छ. See, so even by the help of before histopathology, you can make a provisional diagnosis of dentigerous cyst by looking at the clinical features, that is age and location, and there may be absence of the tooth in the oral cavity. Right? And the swelling may be slow growing and asymptomatic, right? Painless. And if you try to aspirate with the wide bore needle, you get a thin watery yellow colored fluid. In case of OKC, it would be cheesy fluid. Right? In case of blood hemorrhagic cyst, you may aspirate blood. Right? So, any radiograph you will be finding follicular space of more than 5 mm, enclosing the maybe central, lateral, or circumferential variant, and it has to be attached to the neck of the tooth. Treatment depends upon the size of the lesion. Smaller lesion like you just excise. Larger lesion, marsupialization followed by enucleation. Recurrence is not common. So, complications, dentigerous cyst may be converted into amyloblastoma or epidermoid carcinoma, भनेको squamous cell carcinoma or mucoepidermoid carcinoma. So these are the complications of dentigerous cyst. Dentigerous cyst, okay, it may be a potential danger to be converted into ameloblastoma. Right? Kinabhane ameloblastoma associated with unerupted tooth are most of the time misdiagnosed as a dentigerous cyst radiologically. These are the evidence after various studies. Isolated islands or follicles of epithelium present in the dentigerous present in the cyst wall of dentigerous cyst. Usually cyst walls you don't find islands. So these islands could be responsible for development into ameloblastoma. Or cyst, radicular, OKC, paradental, despite those cysts or inflammatory cyst or common cyst, radicular cyst common they do not develop into ameloblastoma as compared to dentigerous. So dentigerous cyst could be a potential threat to develop into ameloblastoma. If the dentigerous cyst is being converted into ameloblastoma, it satisfies Vicker and Gorlin criteria. Ameloblastoma padhacheri we will study it again in detail. Vicker and Gorlin criteria bhaneko chai timro dentigerous cyst, it will usually have 2 to 3 layers of enamel epithelium हैन squamous हुन्छ तर अब initially dentigerous diagnosed भएको case अब slowly if you do not treat that case slowly अब त्यो squamous cells will be converting into columnar cells, tall columnar cells with reverse polarity भनेको columnar cells मा usually nucleus is placed towards the basement membrane हैन but ameloblast मा चाहिँ के हुन्छ त त्यो normal नै हो ameloblast they have a reversal of the polarity त्यो भनेको ameloblast को nucleus is placed towards the apical portion of the cell base मा भन्दा पनि apex तिर हुन्छ so that is known as reverse polarity. The nucleus will be hyperchromatic and there will be cytoplasmic halo है so यदि यो तीनटा कुराहरु satisfy गर्यो भने that is Vicker and Gorlin criteria है so dentigerous cyst यदि ameloblastoma मा convert हुँदैछ भने it will show these criteria so that it has a potentiality to develop into ameloblastoma. Okay, let's see one more today, that is eruption cyst or eruption hematoma. Dentigerous cyst occurring in the soft tissues हैन commonly चाहिँ तिम्रो primary molars हरु हैन अथवा permanent molars नै हैन when they cannot erupt properly है bone लाई when they cannot penetrate the bone properly that when they penetrate the bone but cannot penetrate the soft tissue properly है जसले गर्दाखेरि it results into a cystic expansion of the soft tissue and that results into soft dentigerous cyst of the soft tissue or it is also known as eruption cyst है तिमीहरुले बच्चाहरुको प्राइमरी मोलर्स हरु इरप्ट हुँदाखेरि बच्चाहरुलाई fever आउने and all everything happens systemic complications so that is due to the eruption cyst. It is because the connective tissue remains densely fibrous हैन soft tissue जसले गर्दा tooth ले bone penetrate गरे पनि it won't be able to penetrate the soft tissue. Children of different ages occasionally adult मा देखिन्छ in case of delayed eruption. See this is the thing है first molar premolar को पछाडिपट्टि first molar trying to erupt but not being able to erupt properly right so once the tooth erupt it subsides itself. Color could be bluish or normal, usually painless unless infected. See this thing in the maxillary anteriors you can see smooth circumscribed soft and fluctuant swelling over the erupted tooth हैन tooth तिम्रो आइसक्यो bony crypt लाई tooth ले penetrate गरिसक्यो तर soft tissue लाई penetrate गर्न नसक्दा it results into eruption cyst. See same thing. Sometimes more than one cyst may be present. Brief history of about 3 to 4 weeks is present, usually 1 to 1.5 centimeter in diameter. Radiograph you can just be able to see soft tissue स्याडो है यहाँनिर हेर्नु खोज्यो भने दिस इज जस्ट दि सफ्ट टिस्युको स्याडो मात्रै हुन्छ देयर इज नो बोन इन्भल्भमेन्ट सिन्स बोन यहाँसम्म मात्रै छ टुथ हेज अलरेडी पेनिट्रेट द बोन एन्ड यु क्यान जस्ट सी दिस सफ्ट टिस्यु स्याडो हिस्टोप्याथोलोजिकल फिचर्समा superficially gingival epithelium is seen. Gingival epithelium contains long retices, long test tube like retices हुन्छ gingival को epithelium को. Cystic lining is present of the reduced enamel epithelium. र dentigerous cyst कै features हरु देखिन्छ 2 to 3 layers of reduced enamel epithelium, but you have additional gingival epithelium पनि देखिन्छ. Right, this is gingival epithelium. Okay, see.